Good evening, friends. Once again, we are here. Today, we are going to talk on how to improve the chances of normal delivery. Nowadays, because of the delayed childbirthing, because of the modern lifestyle wherein we hardly use anything sitting down, the normal delivery rates are going down gradually. To sustain that, to maintain that, and to achieve greater chances of normal delivery, there is a lot which can be done. One is the preparation, if it can be started much before, like, even before you married or at an early age, wherein you exercise regularly, that will certainly improve the chances of normal delivery. We cannot change the age. The earlier, the better, certainly, but whatever it is given, we have to make the best of it. So let's believe that you're about 32 years of age, which is the average age of conceiving nowadays. And this is your first baby, and you want to have it normally. You have a very strong desire of normal delivery. Now, one problem I would like to point out is that in the beginning, each one of you has a very strong desire of having a normal delivery. As the time passes, the desire goes down, and as soon as the labor starts, a lot of you give up. I would request to make the decision wisely, think carefully, and prepare much in advance so that you're all ready. To prepare to increase the chance of normal delivery, you have to prepare the mind, the body, and the surroundings. So let's talk first about the body. So you start preparing as soon as you get pregnant. So you start taking your folic acid and other vitamins regularly. Take your iron and calcium on time. Whatever supplements or other dietary advice you're given, you take regularly. You go for your antenatal checkups and not miss anything. It's very important to maintain good physical health in terms of no sugar, no blood pressure, and average size baby. We don't want a very large or a very small baby. Then you have to eat healthy. So what is most important is not to gain excessive weight. Now, a lot of you end up gaining 15 kilos to 20 kilos. This is what most commonly, I would say at least 50% women gain around that much. I would recommend that each one of you should gain between 8 and 12 kilos because that is the optimal weight gain. And if somebody is obese, that woman should gain even less. So optimal. So there's no standard thing that you should be gaining about 10 kilos or 15 kilos. It also depends on your body weight. If your pre-pregnancy weight was very less, like below 40, even if you gain 15 kilos, it's fine. But if your pre-pregnancy weight is already 80, if you gain less than 10 kilos, if you gain only 5 kgs, it is absolutely fine with us. To give you an example, we've had patients who have lost significant amount of weight. So there was this lady, she lost 27 kilos in pregnancy. This is amazing. Somebody can lose that much, yes. So if the diet is well controlled, you eat healthy in a very regulated way, you end up losing. So this lady lost 27 kilos and delivered a 3.3 kg baby. So similarly, I can quote a lot of examples wherein women lost a lot of weight, 8 kilos, 10 kilos, 12 kilos, and delivered healthy term babies, normal deliveries, a lot of them. So, so the target weight gain is not exactly on the weighing scale. It completely depends on your pre-existing weight, your health status, and also what is your fitness like and how you're healthy. If you're eating healthy and if you're losing weight during pregnancy because you switched from a non-healthy diet of juices, sweets, alcohol to a healthy diet of fruits, vegetables, and uh, uh, dal and dairies. So then there's a good chance that you will lose weight. And if you lose weight and in a healthy way, wherein the baby is gaining and you are losing, there is no problem. The dietary recommendation is a lot of people are eating for two. So you should eat only for yourself. There's no reason to eat extra. That means if you were eating whatever you were eating earlier, You can continue eating the same. You can verify it with your doctor. We're not suggesting that you go on a diet during pregnancy. What we are trying to say, you change the type of food that you eat so that you get adequate proportion, because majority of us consume a lot of carbohydrates. So what we are looking at is about 40% of the diet comes from carbohydrate, and the others, or maybe 50%, and the rest comes from protein, fat, minerals, and other things. So that will make a balanced diet, and that will reduce. And when you're consuming carbs, also, you should take simple carbs and not complex carbs. Simple carbs, sorry, complex carbs and not simple carbs. Complex carbs will lead to lower glycemic index. That means your blood sugars will not fluctuate too much, and it will give you a more stable weight gain and a more stable weight gain to the baby compared to the simple carbs, which are like juices and sugary items in terms. So no glucose, fructose. A lot of women are consuming glucon D. So I'm not blaming any brand or anything. What I'm trying to say, in India, it's very common for women to mix glucose with water and drink. It is assumed as a good drink, it is assumed as energy given. So, certainly, if you take sugar, it gives you energy, but this kind of energy is not required. What we need is a healthy food. When you feed sugar to your baby, eventually your baby will also get used to getting these kind of sugars and probably make similar choices a little later in life, which no mother wants. You don't want your child to be eating chocolates and juices all the time, cake, pastries, and not eating healthy food. So it is very important to avoid these things. Whenever you're thirsty, you try to focus on buttermilk. You can sometimes have coconut water. Coconut water again is overhyped in India. It is there is some people believe that if you take coconut water, there would be some skin color change to white color, and that's how women try to consume it daily. Now, this is not correct. Coconut water cannot change the color of anybody's skin. Coconut water is full of calories. It has certain healthy properties too, but if taken daily, it can lead to excessive weight gain because it has a lot of calories. We do not cut on other calories, and if we add on top of it coconut water also, it becomes a little more than we can actually burn. So ultimately, weight gain occurs because of more weight gain, more eating more than what you can burn. So then you must eat small frequent meals so that the body doesn't have large amounts of calories to deal with. As if you suddenly get too many calories, body doesn't know how to spend, and it tries to store all that, and you tend to gain more weight. But if you take same amount but in the space 6 or 7 meals, you will not gain weight because body will find time to burn it all off. So when it comes to veg and non-veg food, so in India there's a lot of concept that this food is hot, this food is cold. So there's nothing of that sort. That this food is very hot or very cold. Excess of anything is not good. If you take excess of black pepper or excess of cloves or excess of anything for that matter is not good. So if you need small amounts in certain way that you need to take, you can always take, or you can consult your doctor. See, why I'm telling you all this, people who consume that, they do not go into preterm labor, and those who've been resting, not doing anything, still they can go into labor. So these factors, this kind of food, hot food or cold food, doesn't determine the duration of pregnancy or the timing of delivery. Anyways, hot food can lead to acidity and other issues. So you should confirm with your doctor whether you can take such food or no. So we talk, then about water. So water is a very important food component which we tend to ignore. During pregnancy, women tend to drink less water, thinking they have to pass urine often because during pregnancy the frequency is very high, and they believe if they drink more, they will have to go more. This is not the right thing to do. You must drink at least 2 liters of water every day, and in summer, if you're sweating too much, you must increase it further depending on how much you sweat and what kind of activity you undertake. If you're an athlete, then you must drink more. If you sweat more, then also you have to take more. And if you are working outdoor and you're sweating for some other reason more, then also you have to drink more water. Now, water can be plain water. If you don't like it, you can have infused water with cucumber, lemon, orange, any drops that you would like to add, you can add, or infused fruits and vegetables, but you should have them so that you can replenish your body with adequate water. There should not be any shortage. Less water will lead to dizziness, constipation, and it can also lead to urinary tract infection. Now, coming to the question that will lead to frequent urination. So, I suggest that you must try to hold your urine and go whenever you feel it's about 250 ml. With time, you can train yourself and avoid the urges at 100 or 150 ml. But if you still feel that you can't train, check your urine for infection. So this is not the prime topic today. Just I thought since we are talking about food, I can tell you. So an optimal weight gain is very essential. So we talked about eating right. Now preparing the mind. Now first thing is when as soon as you decide to have normal delivery, you start hearing difficult stories or horror stories, I call them, from your friends, didis, and other people around you, and you really get scared. Somebody will say ऐसा हुआ, फिर others will say ऐसा हो गया, उन्होंने पूरा हाथ अंदर डाल दिया. So first of all, nobody puts a hand during labor inside the vagina. The digital examination is conducted by using two fingers, the first two fingers, which are not more than about 3 centimeter wide altogether when two clapped. So, and when you think of a baby which is weighing at least 2.5 kilos coming out from the front passage, the fingers are too tiny, so it should not hurt. It is just the fear of getting examined or fear of labor that you get worried about. So please do not get worried about the fear from the fear stories that you listen from your friends, because what happened to one will not be repeated to another. And second thing is, what happened to one will not be repeated to one in the second pregnancy. So each pregnancy behaves differently, each body behaves differently, and each time it behaves differently. Please do not listen to what others have to say. You have to know your chances by knowing to your doctor. You must select the right doctor. You must select the right hospital. You should see the attitude of your doctor towards normal delivery and identify what is your attitude and what is your doctor's attitude, whether you're on the same page, whether your doctor is able to explain to you what is the best thing for you. So there would be certain cases which will not be able to have normal delivery. Like suppose the placenta is low, the head is too large, the passage is too narrow, or there could be some more factors which may not allow a very large baby. So in that scenario, a normal delivery sometimes is not possible. But for majority, these factors are non-existent, and they end up in cesarean only because of the fear. So please prepare your mind well. Now, what happens when we tell you to read on the net? Yes, you must read. There's a lot of information overload, but during the information, not all information is correct. There's some right information, there's some wrong information, and that's where the catch is, how to recognize what is the correct information. So, my suggestion would be make up your mind, read and understand whatever you can, write down your questions and queries, and ask with your doctor on a subsequent visits. You can ask them repeatedly, more so during the third trimester, so that you are completely clear on how a labor works and what is really achievable and what is not. Because for each woman, things may be variable. Somebody who needs to be delivered at 37 weeks because of severe diabetes or severe hypertension or cholestasis for that matter, the body will behave much differently compared to somebody who will go into labor on her own and deliver at 40 weeks. So there cannot be any comparison with your friend who delivered in 2 days or another one who delivered in 2 hours. There cannot be any comparison whatsoever. It's you, your body, and your pregnancy, and this time pregnancy. So everything could be different this time. Then what we were talking is preparing the mind. So you can read some good books, you can read some authentic articles, and if you're in doubt, you verify with your doctor. There are sessions, there are some prenatal classes also which are happening, which prepare you for normal delivery, in which they teach you not only the exercises, they also teach you how you can prepare yourself for normal delivery. So if you have access to them online or something, because these days due to COVID, probably you won't be able to attend in person. You can do that. You speak to the girls and women who are pregnant and motivated to have normal delivery. Do not speak to them who are demotivated, who do not want normal delivery. Somebody who's already had a cesarean section probably would not want another normal delivery, or if they want, there would be some. So it depends. So please stay away from people who are negative towards normal delivery and talk to people who are positive for normal delivery. You also can speak to those who had normal delivery to learn from their experiences. Take the positives, don't imbibe the negatives. If you see any negatives, confirm it by talking to your gynecologist. So, in all, make notes, allay fear, read wisely, prepare your mind, tell yourself you can do it, promise yourself that you're strong. Then, to know whether you're strong mentally, you can do certain tests. One of them is an ice cube test. You can hold the ice cube in your hand and see if you can hold it for a minute without changing. If you can, that means your pain endurance is high and you will be able to take it. You also need to develop techniques that will help you in tolerating labor well, like breathing exercises and various relaxing techniques. Hypnotherapy is not very popular in India, but you may learn it on your own and practice it. Breathing is certainly available. Tense is one method in which some kind of current can be passed during on the back, and it kind of helps in a certain way. Then Entonox is available, obviously because of the COVID times. Entonox is not available these days. Epidural is available. This becomes, it makes the labor completely painless. Then there are certain other injections which can be used. So there's a lot of things. There are a lot of things which are available, which can make your labor comfortable as painless as possible. There are medicines to expedite delivery. There are doctors to support you. There are and mind it, a lot of women have fear of baby might be suffering something during labor contraction. Baby dab jayega. Nothing of that sort happens, and we typically run the heartbeat recording, the NST, to know that everything is okay. So what I'm trying to say is, prepare your mind well. Tell yourself that you'll be able to do it, and have all this agreed upon by your partner and with your close by relative who will be available at the time of delivery. Do not speak to those far people who will give advice from far but will never be available to you in case of need. So speak to your partner and speak to those near ones who will actually come to help you during delivery and labor. So these are the people you should have consensus with, that if you're planning to have a normal delivery, each one should agree that yes, that's the right thing for you, including your doctor. And if you're deciding otherwise, then each one should agree that that's the right thing for you. Till the time, so the consensus has to be achieved between all parties, you, your friends and family, and the doctor. So three parties should align. Then only a very good outcome can be achieved. So it's very important to prepare. Then comes the social structure, that you have to see what your surroundings are like. If you come from a place wherein the facilities are remote, poor, uh, the medical facilities are far, then it is best to have normal delivery. Even if the labor is prolonged and it's a little painful, it is best to try for a little longer. If you are in a city wherein everything is clean and available and there is no risk of infection, you may decide whatever is the best mode of delivery. Now, a lot of people would want to know whether the normal delivery is more advantageous or cesarean. There is no definite answer to this, and it is discussed individually, one to one, case based. There is no standard line that, okay, normal is good or cesarean is good. but certainly a smooth normal delivery is superior to anything else. So, the other thing that you can do in terms of exercises are duck walking, simple walks. You can also do perineal massage, in which you pull your vagina forward and downward and outward by taking some lubricant in your fingers. So it will make the entry of the vagina elastic. So whenever the baby exits, it becomes easier. Now, I can just tell you that, how do you feel during labor? So, as the labor starts, we call it the early or the latent labor, you'll start feeling some contractions. There could be a little bit of spotting or the bloody discharge coming out, some mucus discharge also could come out, but there will be no waters. Gradually, the intensity and the pain will increase. Then your doctor will tell that you're about 3 centimeters. This is now active labor. Beyond that, if required, the water is broken to shorten the duration of labor. You could be given oxytocin or other drugs depending on the need. And gradually, you will find that the baby is going down. You will feel the urge to push, but you shouldn't push unless asked to, because a premature pushing can lead to a lot of swelling on the baby's head and into the cervix and can affect the normal progress of labor further. Sometimes excessive pushing can lead to swelling in the cervix and it obstructs the labor. So your practitioner, your doctor's delivering you will tell you the right time to bear down. So in early labor, you can walk around, you can squat, you can, if your pain is tolerable, fine. If not, you can ask your partner to give you back massage. You can sit down, you can take shower even, you can sit on the loo for some time and meditate, see some TV if possible, try to divert yourself, de- practice breathing. So as soon as you start contraction, start having deep breathing, follow your breath. All this will ease the pain of labor and also take your mind off the pain. This should help you in achieving, but mind it, there is no substitute to preparing beforehand, and it is extremely important to start preparing right from the beginning of pregnancy. Every visit, ask your doctor what kind of exercises you can do, what kind of food you should be eating, what kind of weight can you should be do, what kind of books you can read, what classes you can attend, and be certain that if you do all that, you will be able to achieve normal delivery. So I would really want to wish you luck and hope that it increases your chances of normal delivery. I hope that these suggestions help you, but mind it, you have to be persistent in your effort, in your body, in your mind, and eat right and believe you can do it. Just like the Miss India contestant, when every day morning they get up and tell in front of the mirror themselves that I can do it. So I'm having a question here. Uh, Ashima wants to know, I'm 8 months pregnant. Is there any kind of exercises that can help improve in chances of having a normal delivery? Yes, certainly. Uh, I do not know what kind of physical activity you can undertake, but if your health is good, you must do duck walking. That is the most important thing. So there's a lot of myth here in India that in the seventh month, you should not be doing exercises, and a lot of women kind of take rest and put on so much of weight. They go to the mica in their uh, seventh month because in eighth month it's very risky. The seventh month is not risky, and so on. This is not the right thing. So you can increase your chances of normal delivery by doing a lot of duck walking, squats, and butterflies. Uh, all these sit-ups, these can help. You can have a fair competition with your husband on with the duck walk and see who wins. Certainly, he is lighter and agile and stronger, so he will win. But it'll be interesting. Otherwise, doing it alone is a little difficult. Sometimes it's difficult to make balance while because one duck walking you have to sit flat on your feet, which is a little difficult to probably take support of and walking with your on help to do some stretches. What should I eat in last month of pregnancy with normal delivery? Well, eating healthy is the right thing. Do not gain too much of weight. You can consume once you're 36, 37 weeks, you can start consuming papaya and pineapple to some extent. But eventually, there's nothing which can actually induce labor, and the the God decides when the labor will come. So some people believe that taking of castor oil might lead to labor, which may be true in about 30%. That if you take labor, that if you take castor oil, it might induce labor. Doing intercourse or nipple stimulation can also help in achieving normal delivery or inducing labor. But as such, no particular diet can improve, and there's nothing of hot or cold as such. Another question, hello doctor, my wife is 6 months pregnant and she always complain about her morning sickness. Please advise something to ease the morning sickness. Morning sickness sometimes for some will remain throughout the pregnancy, though there's a lot of ease after 3 months are completed. But some women continue to have morning sickness. So this can be eased by consuming 2 grams of ginger every day. This can be in the form of ginger tea, ginger milk, ginger cookies, or plain ginger in the food. Uh, there are medicines available, pyridoxine or domperidone also can alleviate nausea. So pyridoxine can be used freely up to 3 times daily, depending on if it is more in the morning, you can take 2 in the night. Uh, Further dose cannot be described without seeing the patient. It's a general advice. But and drink small frequent meals. Avoid very hot, spicy food. Do not lie down immediately after eating. Walk around. This will certainly reduce the sickness. My wife is 36 weeks pregnant, and during a scan, doctors told us that the water level is high. Is it safe? What precautions should we take? Typically, excess water is seen in cases of high maternal blood sugars. So first thing is you must check her blood sugar. She should also do a glucose tolerance test if not already done. And if these tests they show higher value, then she has to control her sugars very well. The other causes of excess water are also linked with sometimes the fetal well-being. Now, the anomaly scan, if it is done right, can diagnose most of the anomalies with the fetus, but sometimes there could be certain hidden things like a tracheoesophageal fistula, which cannot be seen on ultrasound. These things can only be seen after birth. So these are very rare conditions, so do not look into that and get panicky. It's only typically abnormal blood sugars. So try to look for diabetes very carefully, and probably you will find one. Next question. I'm 12 weeks pregnant and I have pains and cramps. Is there anything I can do? So you didn't mention there are pains and cramps. So if there are pains and cramps in the legs, then a massage can be done from below up, or you can wear a crepe bandage. You can elevate your legs. You can soak your legs in salted water if it is so. If there is pain in the abdomen and cramps, then you must see the doctor to identify what are the causes. Typically, this early pregnancy losses are extremely rare, though could be seen. So such an advice cannot be given on phone, cannot be given on the presentation, because if it is something related to the uterine contractions, then it will be a trouble. So I think the treating doctor should be able to find it. Hello, doctor. My wife is 37.5 weeks pregnant. She feels her womb tight. Is it normal? Yes. During the ninth month of the pregnancy, so she's now running ninth, so there are Braxton Hicks contractions. Sometimes they are painful, sometimes they are painless. Uh, Earlier, they were always considered painless, but nowadays a lot of you complain that it is painful. So whatsoever, so tightening of the abdomen or the uterus or the womb during the ninth month erratically is very common. These are also known as preparatory pains. If it is more like if there's a pattern, it could be a latent labor, but if the pattern is very fixed and the pain is lasting for more than 25, 30 seconds and coming every 15, 20 minutes or less, then this could be actual labor. And in that scenario, you should get examined, because not everybody will shout and complain too much. Some people can actually be in labor with very little pain. So if it is so, please get examined. So thank you so much for joining today's webinar. We hope it was a useful session for you. Would like to hear from you if you have any